Wait for our cameras to crank up here, guys. So if you just hang on a second, we got to make sure everything's working properly because we have multiple cameras here. We have to get working, and John's pushing buttons, and we have everything ready to go. There we go. Hey, it worked. Hey, folks, I'm glad you're here. I'm Dr. Joe Esposito. First time joining us. Welcome. Glad to be here. This show is unlike anything else in the world. What we try to do is we give you tips on how to naturally get well and stay well. Things that you can do every single day to take control of your own health. Now, you don't have to do all of them. Do something. You'll probably see results. That's the nice part. So what we do is I talk for 24 minutes. At the end of 24 minutes, I will then take a break. You guys can then type in any questions you might have. So any health questions you have, type them in throughout the 24 minutes. It doesn't have to be right at the end. Type in your questions. I will then go ahead and answer your questions at 24 minutes. Then we go do another 24 minutes, and then we take another break and answer questions again. So that's how the game is played. This is an amazing opportunity for you to get your health questions answered. You're not going to get that anywhere else. So many patients ask me those questions. Where do I go? I don't know where to go. This is the place. So 24 minutes questions, type them in anytime. Please share this with your entire group, whoever's in your leads, because this is vital information. Hopefully every show I do, my goal is to try to save your life. So I'm ready to start when you are, John. Here we go. Hey, folks, Dr. Joe Esposito here. I am glad you're with me today because today we're going to talk about a fun topic, actually. Sometimes I get serious. Sometimes I get technical. Today's fun. Well, not fun. Serious, though. Are there any hazards hiding in your medicine cabinet? This is a big topic because right after today's show, I promise you, you're going to go home and go, I never thought about that. I never knew that was an issue. So everything from mouthwash to toothpaste to medication to Q-tips. We're going to cover it all. So if you have any questions, you can always send them to me through my website, drjoe.com. But let's tune in first. So I want to jump in. I got so much to cover here, too. Let's talk about cotton swabs. These can be good for putting on makeup, doing your nails, number of odd jobs around the house. Never put them in your ear. And that's the irony, is that that's what you think they're used for. They're used for sticking in your ear. And even on the box it says, don't stick in your ear. Earwax that builds up in your ear is actually something that's necessary for good health for multiple reasons. Number one, it protects things from getting in your ear. Bugs, viruses, germs, bacteria, dust. But also, I said viruses and germs. I realized this way back when I was a kid. I used to clean my ears all the time with my cotton swabs. And you go, oh, look at all that earwax I got out. Oh, that was a good one today. And then I'd get sick. Within a day, I'd get a sore throat almost always on the side that I cleaned. So I cleaned my left ear, I'd get a scratchiness on the left side of my throat. Never correlated the two until I became an adult. And then I realized there's a eustachian tube, the connection between my ear and my throat. And that earwax is protecting viruses, germs, and bacteria just floating around the air from getting into my throat. So it settled in. Now, I never saw any research on that. It just kind of something I put together. But you're opening up an entry into your body. Now, your nose has hairs in it, and it has mucus. Your mouth has saliva in it to protect it. But this stuff can go right through your ear, right into the back of your throat. So don't use them. And also, if you push that earwax in too far, it can cause damage. And, of course, if you push too hard, you can rupture your eardrum as well. So cotton swabs are not designed to be used in your ears. So what do we do about earwax? What you can do is, when you're in the shower, take a washcloth, put it on your finger, and clean as far back as you can with your finger. If you want to use your pinky finger, it's fine. That's it. Don't go any further into your ear, because then you can irritate the ear. Sometimes you get itchy ears. I know I've done that already. If I clean my ears, it itches, and I want to keep scratching my ear and scratching my ear. What do? I'm taking whatever I have in my finger and driving it into my ears. So don't use these cotton swabs on your ears. Anything else but that. Now, how do you clean out earwax? When you chew, every time you're chewing, that chewing mechanism is pushing the earwax very gently further into your ear canal and then out. Then you can take a washcloth and clean it out that way. But whatever in your ear is fine. Now, if it does get clogged up, and it happened to me once in my life, it was just so clogged that I couldn't get it out. They have things in a drugstore. I can't think of the name of it. What it is. But anyway, it's like a hydrogen peroxide type fluid. You put it in there, it dissolves the wax, and then you can suck it out. And that's okay. And then if it gets really bad, one time I did have to go to a medical doctor, and they did flush it out. They used something that was equivalent to like a water pick. I shot it in my ear, broke it up, and the wax came out. So as long as you're taking good care of your ears, you're probably not going to have an issue. If you do, you have drugstore, and then you have medical if you need to. But please don't stick those things in your ears. So if you're just tuning in, I know folks tune in all the time. What we're talking about today are hazards, dangers, hidden dangers in your medicine cabinet. So please be careful with that. I want to talk about medications too. Now, again, I'm not telling you to take drugs or not take drugs. I'm not prescribing drugs. I'm not telling you to discontinue your prescriptions. But I want you to understand that drugs in your medicine cabinet can be very dangerous, especially for two groups, the very young and the very old. That's always the warning, but I see it all the time with patients too. Had a patient come in the other day. I hurt my back. Well, not surprisingly, I'm really good at back pain. I've been doing it for 40 years. And a friend of mine, here it comes. A friend of mine had medication from when they hurt their back. And so I took the medication. Could be outdated. It could not be the right strength. It could be the wrong drug. This is why we like doctors who are experts in medicine to write prescriptions. If you're not an expert, you shouldn't be writing prescriptions. And so we have laws about that. So members of your family, if you share one medicine cabinet, very careful when it comes to pain relievers. But in this case, talking about aspirin, we're going to cover a lot more after that. It's safe for most adults, but if you take blood thinners or you have a heart condition, it can be a very serious issue. So we had aspirin. When I was a kid, pretty much it was aspirin. Then ibuprofen, then acetaminophen, then naproxen. So we came out with other non-steroidal anti-inflammatory over-the-counter medications, and they all do different things. I'm going to talk about that in just a second. But if you're on blood thinners, it can lead to bleeding in your stomach and your intestines. Never give it to children under 2 years old or teens who are getting over an illness with flu-like symptoms. It's not designed for that specifically. In those cases, aspirin is linked to a rare but serious condition called Ray's syndrome, and it can cause swelling of the liver and the brain. The other thing that aspirin can do is cause tinnitus, which is ringing in the ears. And it could be a vitamin D deficiency as well. Sometimes vitamin B is related to that. High blood pressure is related to tinnitus. And I get that question usually about 3 or 4 times a week on my website, drjoe.com. I have ringing in the ears. I have tinnitus. What do I do? And first thing I have to do is I have to say, what medications are you on? Do you have high blood pressure? I check to see if they have pinched nerves in the neck. The atlas, the top bone in the neck, can move out of place and irritate the eustachian tube. And it can also irritate the auditory nerve, and that can cause ringing in the ear. So it could be a physical irritation, and that's where chiropractic may solve the problem. It could be a chemical irritation. It could be dehydration. So I like to look at somebody's lifestyle and see what are the complicating factors that may be causing the tinnitus. Usually I'm right. Sometimes I get stumped, but usually it's something I can figure out there. But aspirin can cause tinnitus, so just be really careful with that. Let's talk about other pain relievers. Now, when it comes to pain relievers, I am not against pain relievers. If I'm in pain, I want to get out of pain. That's my job. That's my goal. I want to get out of pain fast. I have a traumatic brain injury. I was hit by a car when I was 10 years old, and periodically it flares up and I get a severe headache on the left side of my head. I want that pain to stop. So I'll take acetaminophen. Acetaminophen is designed to block pain. Ibuprofen is designed to reduce inflammation. I always remember I, ibuprofen inflammation. Acetaminophen blocks pain. Acetaminophen works for me, but it makes me tired, and pretty much it can adversely affect my day. But when it happens, I know I've got to get to my chiropractor right away. Because in my case, if my first and second rib on the left side are out of place, it affects the levator scapulae, which is a muscle, which pulls on my atlas, the top bone of my neck, and that causes radiating pain, causing headaches. It took me decades to figure out that sequence. So now I know if something flares up, even if I don't have pain in my first and second rib, which I don't, I've got to get the first and second rib adjusted. I don't want to adjust the atlas because it's not the atlas, it's the muscle attached to the atlas. So I have some trigger point work done on me, and then my problem goes away. I treat the cause and I treat the symptoms. So just be careful with these non-steroidal anti-inflammatories. They can also thin your blood. Now, if you take prescription blood thinners, that can cause some real serious bleeding because your blood gets too thin, and that becomes a problem. Now, if you take them too often, you're more likely to have a heart attack or a stroke. It can also be bad for your kidneys, especially if you have kidney problems. Now, I've been in practice 40 years. When I first got in practice, I never saw a patient with kidney problems. When I say never, I mean never. Probably the first 10, 15, 20 years, I never saw a patient with kidney issues. Now we see 2 or 3 kidney patients a week. Something's different. Now, am I just a better doctor and I'm attracting kidney patients? Probably not. I just think more and more people are having kidney issues. And one of the big issues is that if you eat too much protein, it can adversely affect your kidneys. And I said this one day. I was a guest on a show the other day, and I mentioned this. And somebody sent me a message through my website, where's your research? So I sent them the research. Well, I don't agree with that research. Okay. I saw some guy on YouTube say that against what I said. I said, okay, so I have documented research, double-blind studies, proving that I'm right, and you saw a guy on YouTube who said it. I said, feel free to eat whatever you'd like. I wish you all the best in your future. I'm not going to argue with these people, okay? I can probably find research on both sides of just about anything. This is the research that after 40 years, I know works. And I know it because I'm in practice. And I wasn't going to argue with this person, say, are you in practice? Do you see patients? Because these are just trolls on the internet. But I want you to understand that the research is very clear that too much protein can adversely affect your kidneys. And it worries me because a lot of people are on these high-protein diets, these carnivore diets. Short-term, they seem to have some medicinal benefits, maybe lose weight. Okay, the keto diet. The keto diet was not designed for anything except patients with seizures. When it was first came out, patients were having seizures. We put them on a keto diet. It seemed to help the seizures. Then we started running with it. Not a fan, because your body needs the nutrients that are found in fruits, vegetables, nuts, and seeds. We know that the brain works best on carbohydrates. It's the most efficient way of burning. Now, when I say carbohydrates, I don't mean breads, cookies, cakes, donuts, and pastas. I mean things like lentils, split peas, complex plant-based carbohydrates. That's the way you want to go. And the research is clear. Now, I always tell patients, you don't have to do everything I say. You can do a little bit, you can do some of it, you can do all of it, whatever works best for you. What I try to do is give you the best information possible so that you can make a decision. And what usually happens, I've been doing this a long time, what usually happens is patients will take a little advice and they'll start to feel a little better. And then they'll say, you know, if that worked, let me try this, let me try this, let me try this. And eventually they come around to my way of thinking. Now, I don't have any dog in the fight if you come around to my way of thinking. I just want you to know the best information and what works with 40 years of clinical research, plus the medical research and scientific research is out there as well. So when it comes to medications, they can adversely affect your kidneys, but so can too much protein. And if you combine the two, now we got a problem. So if you're just tuning in, I'm Dr. Joe Esposito. What we're talking about today are hidden dangers in your medicine cabinet. And just because it's over the counter doesn't mean it's innocuous, doesn't mean it's safe. Follow the directions. But with any medication, I'm fine with you taking the medication, but I want you to think this thought. Why am I taking this medication? Why do I have high blood pressure, diabetes, high A1C? Why do I have asthma? Why do I have digestive issues, heartburn, acid reflux, burping, gas, bloating, clogged arteries, erectile dysfunction, brain fog? Those are common things. I see it every day in my practice. I want you to think, why do I have these problems and what can I do to fix them? Let's fix the cause of the problem, not just treat the symptoms. So over-the-counter medications for pain? Absolutely, if necessary. But what if we can fix the cause so you don't need the medications? That's a pretty cool approach, isn't it? So going down a rabbit hole for a second here. If you have pain, the number one cause of back pain is pinched nerves. And the number one treatment, by far, most effective, least expensive treatment for back pain. You want to know what it is? Chiropractic care. Chiropractic care, most effective, least expensive treatment for most back pain issues. Not all, most. So if you have pain, why don't you go to the website right now, drjoe.com, make an appointment to come see us. In the Atlanta area, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. We can get you in this week. I would love to be your doctor. Normally, the first visit is $940. For you, my listeners, I've reduced that to $299. That's an exam, x-rays, consultation, first treatment, going over the x-rays, and a complete nutrition evaluation. All of that, $299. And then at that point, we'll sit down, discuss our findings with you. and say, this is the direction we think is going to be best for you. Most effective, least expensive. That's always the route we go. Sometimes it's most times it's chiropractic. Sometimes it's surgery. Sometimes it's injection. Sometimes physical therapy. Sometimes it's strictly nutrition. I've had patients with blazing headaches. I've been to 5 different chiropractors. Nobody can help me. I look at their diet. What are you drinking? I'm drinking diet soda every day. Let's cut out the diet soda for a week and see what happens. I told the story the other day on one of my shows. I was at a car wash. A young kid came up to me. He says, "You're Dr. Joe, aren't you?" I said, "Yeah." He said, "You lectured to," I think it was his grammar school class, like 35 years ago. He said, "And I had real bad headaches, and nobody could help me, and I take all these medications and all these doctors, and you had mentioned how artificial sweetener, number one side effect is headaches." He says, "I gave up artificial sweetener that day. I haven't had a headache since." He said, "I never thought I'd have the opportunity to meet you and thank you. So thank you." I thought it was really cool. Here's 35 years later. Changed this kid's life. The whole trajectory of his whole life changed because he stopped drinking diet sodas. That wasn't a chiropractic case. That wasn't a medical case. That wasn't a drug case. That wasn't a surgical case. Just had to stop causing it. So I want to be your doctor. If you want to make an appointment, drjoe.com. We can get you booked, like I said, as soon as possible. We accept most insurances, car accidents, sports injuries. Let's get to the cause of your health issues. Let's not just treat the symptoms. So if you're serious about wanting to get well, go to drjoe.com. We'd love to get you set up as soon as possible. So what we're talking about today are hidden dangers in your medicine cabinet. And we talked about over-the-counter medications, but that also goes for leftover prescription medications. And this is a biggie. Very few people finish their medication. Sometimes you're supposed to, but many people die. Pain meds. I took 3 or 4. I felt better. I got my chiropractic adjustments. Got to the cause. I still got a half a bottle of pain meds. I hear that a lot. So if your doctor gives you medication for a specific condition, use it as directed and then get rid of it. This is what I have to tell you to do. Best way to dispose of expired, unwanted, unused medications is they have something called the Drug Take-Back Program, often found as a collection site at the pharmacy. And just go to your pharmacy and say, "Hey, I've got these leftover medications. They're expired. I don't need them anymore. What do I do with them?" The pharmacist will then direct you as to what to do. Don't grind them up. Don't flush them down the toilet. And if you flush them down the toilet, let's assume you flush them down the toilet, okay? The water we drink is recycled sewer water. So I flush my toilet, I shower, we recycle it, and then, Bob up the street's going to use it to boil his tea in. So that's how it works. And we can filter out viruses, germs, bacteria. We can figure out, particles. We don't really have filters to filter out a lot of the medications. So if I'm dumping my medication down the toilet, it can get into the water system. And again, is it going to kill somebody tomorrow? No. But these things can be cumulative. So just be cautious. Take it back to the pharmacy. It's a much better way to do it. And the pharmacy will tell you what to do about it. So, and don't take expired medications because they may not work or they may actually have adverse effects. It's like eating expired food. Well, it may not be the best thing for you. I want to talk about the number 3 medication that I see patients with. And that would be acid reflux medication. Okay? Blood pressure is number 1. Diabetes and cholesterol is number 2, and then acid reflux medications. And this is just my experience in practice. So there are things called proton pump inhibitors. And it can ease the pain caused by acid reflux, but because with acid reflux, you have a sheet of muscle called the diaphragm. Your stomach sits below the diaphragm. Your stomach can push up or rupture up or herniate through the diaphragm, and that can cause acid reflux. So acid comes up into your throat. So you might have burning in your throat, burping, heartburn, bad breath. It can all go all the way up to your sinuses and cause sinus problems. And so sore throat. Singers many times have this. Their voice starts to go. And so we can give you medication to neutralize the stomach acid. Usually works pretty well to treat the symptoms. But here's the problem. You need stomach acid. You need stomach acid to digest food, specifically proteins. So if you start taking these medications to shut down or lower your stomach acid, you may not be digesting your proteins properly. The proteins, these chunks of proteins that aren't broken down into something called amino acids, then pass into your small intestine partially digested, where essentially they rot. They putrefy, actually. Proteins putrefy, and it can give off gases. So you may have terrible gas, burping, bad breath. But more important than that, you're not breaking your proteins into amino acids. There's 20 amino acids in the human diet. And the amino acids, what happens is you eat protein, the stomach breaks it down into amino acids. The amino acids get absorbed into the blood, go to the liver, and the liver says, what do we need these amino acids for? All right, Joe just worked out, and he worked out his bicep. So what amino acids go into my bicep? And the liver goes, boop, 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 boop. Let's send those over to the bicep. Again, this is very simplified. Joe needs neurotransmitters in his brain to make his brain work. So let's send serotonin up to the brain. And how do we get serotonin? Well, we get it from tryptophan. Tryptophan becomes serotonin. Serotonin becomes melatonin. Melatonin helps me sleep. Tyrosine becomes dopamine. Dopamine gives me pleasure. Dopamine becomes norepinephrine, gives me energy. Glutamine becomes GABA, suppresses pain. Now, I know it's a lot of mumbo-jumbo science I just gave you there, but if you're not breaking down your proteins and absorbing the nutrients, your body can't function properly. If you ever read the instructions on a lot of these heartburn medications, the directions are very clear. They usually say take for a couple of weeks. And then what? Stop. The problem is they work to cover up the symptoms. You stop taking them, symptoms come back. So there's no step 2 after this. I got acid reflux. I take the medication. I can't take it for more than a couple of weeks. What do I do? The answer is, many cases, not always, the stomach is pushed up against the diaphragm, and my team of doctors and I can actually adjust or pull the stomach down away from the diaphragm. We do this all day, every day. I did an unscientific study one time on patients. I took 100 patients, and I tested them to see if their stomach was pushed up against the diaphragm. A special test we do. It takes about 5 seconds to do. About 85% of them had tested positive for the stomach not working properly. If the stomach isn't working properly, you can't break proteins into amino acids. Amino acids become neurotransmitters in the brain. The brain can't work properly. Can't happen. And so we can take other medications for anxiety, depression, ADD, ADHD. I'm not saying don't take them. Please understand, I'm not saying don't take them. But if we fix the stomach, in many cases, in my experience, we see people reduce their need or eliminate the need for a lot of these medications because the brain is working more efficiently. Okay, I'm not telling you to stop taking your medication, but let's try to fix the cause of the problem, not just treat the symptoms. Had a patient come in the other day, a young kid, and he was very hyper, trouble focusing in school. And so I said to the mom, I said, let's give him some methylated B complex and let's see what happens. Doesn't work, it doesn't work. He took some pills for a while. So I made friends with the kid, so he kind of liked me. And then I gave him the medication, the supplements. And I spoke to his mom the other day, and she said, he's still hyper, but he's focusing so much better in school. So here he was not getting enough B vitamins to produce the neurotransmitters to make his brain work. His brain can't work unless you have the nutrients available. Next step, I'm going to check his stomach to see if he's digesting his food properly. And if he's not, let's fix that too. Do I have a cure-all? I don't have a cure-all for anything. But I know after 40 years of doing this, I know the things that I've seen work in the clinic, and then I've had the research to back it. So if you have a health issue, neck pain, back pain, shoulder pain, digestive issues, nutritional concerns, brain fog, make an appointment to come see us. Go to drjoe.com, drjoe.com. We can do remote consultations or we can do them live. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. Let's get to the cause of your problems and stop treating the symptoms. No, I take that back. Don't stop treating the symptoms. Let's get to the cause of the problem so you don't have to treat the symptoms. How about that? That's better verbiage there. So if you're just tuning in, what we're talking about today are dangers that are hiding in your medicine cabinet. And the heartburn medication, chewable antacids, can be a problem too. They can cause constipation, cramps, diarrhea. Some of them cause headaches, dizziness, more serious effects like confusion, chest tightness, sore throat, fever, unusual heartbeat because it affects the heart, and even weakness in some people. So once again, if the stomach is pushed up against the diaphragm, if we pull the stomach away from the diaphragm, many times that helps treat the cause and not treat the symptoms. The other concern I have with a lot of these chewable antacids is they're made with calcium carbonate. Calcium carbonate is one form of calcium. There's many forms, calcium citrate, lactate, carbonate. Carbonate is the cheap form, metaphorically and financially. It is a cheap version. It's basically chalk. The chalk you write on the chalkboard, that's calcium carbonate. And what calcium does, it helps neutralize acid. And so the calcium carbonate can block up your receptor sites so you can't absorb other types of calcium. And that becomes a big issue. So I'm not a fan of calcium carbonate for any purpose whatsoever, except it's cheap. But I don't want you to do it. Okay? And it can actually block up and prevent you from absorbing the good types of calcium, and that can lead to other problems with bone loss and other things like that. All right, I'm noticing I got to take a break. If you have any questions, folks, send them to my website, drjoe.com, drjoe.com. You can book an appointment through my website. Send me any questions you have through the website, drjoe.com. Happy to answer any questions for you. But most important thing you can do is make an appointment. Follow me on social media. Just look up Dr. Joe Esposito. Facebook is the Dr. Joe Esposito. Follow me. We post every single day. You're going to get little tidbits every single day. And, of course, on YouTube, you're going to get the long version of that. And on the other ones, you're just going to get 1 minute posts. And all the supplements we talk about are also available on the website, drjoe.com. Folks, I'm Dr. Joe Esposito. Don't go anywhere. We're going to be right back. All right. Good? Good? Good. John, good?
Very good.
All right, John says good. Now John's going to read me the questions, and I will see if I have any amazing answers for you.
Is walking or jogging a healthier exercise?
Walking. Yeah, jogging is great, but most people that jog eventually come to me and say, I can't jog anymore. And the knee gives out, the ankle gives out, the hip gives out. Walking is just as good. And when you walk, make sure you swing your arms. Right arm, left leg, left arm, right leg. Now, let me say that again because you didn't hear me. Right arm, left leg, left arm, right leg. If you swing right arm, left leg, you're short-circuiting your brain. Your brain is integrated. Right side of the brain controls left side of the body, left side of the brain controls right side of the body. So if I'm swinging my right arm, my left leg, and then my left arm, my right leg, I'm integrating my brain. I'm using both sides of my brain. If I'm not swinging my arms, or if I'm just using one side and then the other, I'm segregating my brain, and it essentially short-circuits the nervous system. I have a video on this. I'm going to post it again. I posted it a while ago. I'll post it again on you. It's called a cross crawl. So walking is great. Swinging your arms and legs. Ladies, if you carry a purse, gentlemen, put your hands in your pockets. Stop it. Put this purse over your shoulder and swing your arms and legs. Now, the more you swing, the better it's going to be. But even if you're just gently moving back and forth, that's the best thing to do. Again, jogging is fine, but it can really cause problems later on in life. So that's why I like walking. What else you got?
I have sleep apnea. Also, I have a CPAP machine. It doesn't seem to be working. I think I have insomnia. Any supplements you think may help?
Well, I'm going to talk about supplements. First, I'm going to tell you, let's see if we can get rid of the sleep apnea. In many cases, not all, but many cases, the stomach is pushing up against the diaphragm. Now, when I'm sitting up, standing up, gravity is pulling my stomach down, so I'm in good shape. When I lay down, I don't have gravity to pull my stomach down. And so my stomach pushes up against my diaphragm. I try to breathe. My lungs expand. My diaphragm goes to drop down, and it can't because the stomach is there. So I have trouble breathing. And then I start gasping for air. Sleep apnea. So in many cases, when we pull the stomach away from the diaphragm is able to move properly, and I'm able to get a good night's sleep. So sleep apnea may be a physical problem, not a chemical problem. Now, let's talk about if it is a chemical problem. You want to not do any stimulants, because stimulants like coffee has about a half-life of, 8 hours, I think it is. So in 8 hours, half the coffee is going to be out of your system. What about the other half? Still there, the caffeine. Now, I've known very strange people in my life who can drink coffee and go to sleep. I don't know. They must be possessed or something. I don't think that's normal. So, but generally speaking, it's a stimulant, and we don't want to do that. Also, depends how old you are. If you're drinking a lot of water. If you're drinking a lot of water, you get up and pee all night. Not something you want to do. So I stopped drinking water about 3 o'clock in the afternoon. Now I'll have a sip or two with dinner or something like that, but my big water is before 3 o'clock in the afternoon. And the reason is I'm up peeing all night if I don't. Now, once a night, even twice a night, that may be acceptable, especially as you get older. But anything more than that, you probably want to look at the nerve supply in the low back, pinching the nerve to the bladder, swollen prostate for men. Constipation can cause an issue. Constipation can put pressure on the bladder as well, and then drinking too much water. So with the sleep apnea, if you're waking up to pee, we got to address that issue. If the stomach is up against the diaphragm, we have to address that. If you're doing stimulants, we have to address that. But really, one of the big things that everybody should do is not eat about 4 hours before you go to bed. If you eat dinner at 5, 6, 7, 8, 9, 10, that's probably a good thing. If you're having dinner at 8, 9, 10, going to bed, not a good idea. The food is still sitting in your stomach, pushing up against your diaphragm. So stop eating at around 5 or 6 o'clock or 4 hours before you go to bed. Check the stomach, cut out the stimulants, and go to my website, drjoe.com, and type sleep in the search bar. We did a real good show on sleep, and you can learn a lot from that, too. What else you got, Jonathan?
What is your opinion on silicone baking pans? Are those pans bought from health food stores safe for baking?
Silicone, I talked about this last night on my radio show. Silicone is supposed to be inert, which means it doesn't have an effect on the body. That being said, there are cheap versions of silicone, and they may be releasing xenoestrogens, foreign estrogens, endocrine disrupting chemicals into the body. So because of that, I don't feel comfortable with them. Now, the only thing that's really going to be nonstick, you can do, nonstick could be iron frying pans, but you have to season them, if you know what that means. Glass sometimes works. Ceramic is probably going to be your best bet, but make sure the ceramic's made in the United States. If it's made overseas, it may have toxic chemicals in it. So I don't know about silicone because, in theory, they're inert and non-reactive with humans. They're not a biohazard, but we don't really know what the silicone's made out of, so I say no. What else you got?
A comment from our listener, many physicians don't write prescriptions based on their medical knowledge. They write them based on pharmaceutical perks they receive.
Well, that is a cynical way to look at it, yes. I'm not denying it. But that's why I try to surround myself with really good doctors, the ones that I would go to if I have a problem. And I do go to them if I have a problem. I just before I started the show today, a friend of mine who's a hand surgeon said, I'm sending you this patient. And he said, patient's overweight. The insurance company will not certify the surgery because she's too unhealthy. Let's get her healthy enough so I can do the surgery on her. I said, yes, sir. And so that happens a lot. In fact, several surgeons have come to me and said, please even start a company that does this because nobody's doing that. And so I'm probably going to have to do that because there's such a demand for it, to take people that are sick and try to get them well enough to then go back and have the surgery. So what else?
Please talk about advanced glycation and AGE products, protein or lipids combined with sugar. How dangerous is it? Every meal has these 3 micronutrients. How do we avoid or minimize AGE?
I think you just said it, didn't you? Stay away from sugar. Advanced glycated end products, AGE. It's kind of funny. It's called aging. They bind to protein. Sugar binds to proteins, and it can get into your collagen, your connective tissue, and can create wrinkles. It can speed up the aging process, weaken the organs in the body. So staying away from sugar is really the key to avoiding AGEs. And then, of course, you always want to stay away from omega-6 fatty acids, those polyunsaturated fats, because they can get into the cell wall and cause damage as well. So if you eat sugar, you are speeding up the aging process because you're creating these advanced glycated end products, which combine to your connective tissue and cause some real serious damage. So another reason not to eat sugar. Stevia is your friend. Allulose is your friend. Those are better choices. Lohan is a choice, but don't eat sugar. What else you got?
How do you treat low testosterone?
Low testosterone. Good question. As you get older, your testosterone is going to drop. Now, I'm coming out with a supplement that's going to have things like Tongkat Ali in it and other nutrients that have been shown in conjunction with other things to help increase testosterone levels. It is not a testosterone replacement, but we have it done. We basically just have to put the labels out and get some samples in, make sure it's what I want, and then we can go ahead and launch it. It's going to be for men and women. We're going to have a men and a woman. It's also going to help be a libido stimulant, which is kind of nice too. So testosterone, the quickest way to build up testosterone is sprinting. If you want to go out for a walk and then sprint as hard as you can for about 10 seconds and then stop, get your breath, do it again, or as long as you can sprint. I mean, I don't think I can sprint more than 10 seconds at this point in my life, but sprinting is the quickest way to build up testosterone. The other thing you want to do is not use up your testosterone. And as we get older, our testosterone converts into estrogen. And there's an enzyme in your body called aromatase. And aromatase converts testosterone into estrogen, which lowers my testosterone levels then. So you want to do something called an aromatase inhibitor. And a natural aromatase inhibitor occurs in cruciferous vegetables, broccoli, kale, and it's called diindolylmethane. Now, I take a supplement of diindolylmethane every day. It's called Dr. Joe's Estrogen Regulator. And you look at it and you think, well, that's estrogen. It's not for men. It's for women. No, it's mainly for men. Now, if a woman is estrogen dominant, okay, if she's overweight, if many times if you can't build muscle mass, you have just a little soft in the muscle area, that usually means you're estrogen dominant. We can do a test called the Dutch test to find out your estrogen levels. But The diindomethane is for men and women that are estrogen dominant. I do not recommend it for menopausal or perimenopausal, postmenopausal women. Don't take it if you have that. And this is why you want to have somebody advising you on supplements aside from Dr. Internet. Dr. Internet may not be giving you the best advice, and many times the things you read are sponsored. They're hosted. I want to get paid. I'm going to put my research right at the top, and then people are going to read it and say, oh, well, I saw it on the Internet. It must be true. No, I got 40 years experience. I learned stuff on the Internet. I'm not saying it's wrong, but you want somebody when you're messing with supplements to know what they're talking about, and that's why I want to be your doctor. So Dr. Joe's estrogen regulator, men's hormone support or women's hormone support. They're on the website, drjoe.com. Adrenal support, because the adrenal glands produce testosterone. Losing weight is a key, because if you have adipose tissue produces estrogen, which then counteracts testosterone. And so losing weight is going to be a key. We have a protocol called the 21-day detox program on the website, drjoe.com. And very shortly, when you purchase that, you're going to get a 8-week class that I taught on weight loss, absolutely free. I'm going to give it to you as a bonus. And so, yeah, losing weight, staying away from estrogen compounds. I did a show yesterday. If you go to my website, drjoe.com, and listen to the podcast from last week, we did a whole show on endocrine disrupting hormones and chemicals like that, and you want to stay away from them too. So you can take estrogen shots. Boy, that's a lot easier, but you know what? You lower your body's ability to produce testosterone, and eventually your testicles will shrivel up. And it's going to be real hard to start making testosterone once you stop making it. It's hard to jumpstart, especially as you get older. So I don't recommend that. So hopefully that answers your questions, and that'll get you where you need to be. What else?
That is all.
All right, good. All right, let me get a little sip here. All right, where was I? That was a while ago, wasn't it? Okay, I'm ready. Hey, folks, Dr. Joe Esposito. If you just joined us, welcome. If you stayed with me, I'm glad you did. What we're talking about today are hidden dangers in your medicine cabinet. It's a lot of fun things that you never even thought about. And every time I do shows like this, people say, I never thought about that before. Well, that's why I'm doing the show, because if you thought about it, you wouldn't need me to give a show on it. So we just talked about antacids and heartburn medications and what to do about that. Another thing you can do if you have heartburn is try some raw organic apple cider vinegar. Because many times with heartburn, not only is the stomach physically out of alignment and pushed up into the diaphragm, and we can adjust that and pull it down, but your stomach is low in acid. I know that sounds counterintuitive. But if your stomach's low in acid, the food sits in your stomach for too long, and essentially it rots. And when the food rots, it can reflux back up into the throat. So you take about 2 tablespoons of raw organic apple cider vinegar, mix it in a glass of water. You can mix some stevia in there if you want to make it sweeter, or just have a salad with apple cider vinegar on it. And many times that'll increase your stomach acid, which will digest the food faster to pass it into the small intestine so it doesn't rot and reflux up into the throat. But if you listen to the first part that I talked about, we talked about antacids, and many times they're calcium carbonate. And the reason you take them is it helps neutralize stomach acid. Well, let me circle back to that because that's important. If you eat an acid diet, alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener, breads, cookies, cakes, donuts, pastas, if you're eating a high acid diet, your body has to neutralize those acids when it gets into the blood. The body uses calcium as its primary neutralizing agent. So your body is taking calcium out of the bones and neutralizing the acid in your blood. If you do this long term, eventually you start to lose calcium in your bones and can lead to things like weakening of the bones, osteopenia or osteoporosis. So we take antacids because it has calcium to neutralize acid, but if you have acid in your body has to get the calcium from somewhere. It's going to steal it from the bones. That's another reason why I don't recommend a high acid diet, because eventually you're going to have to pay the piper on that one. You're going to have to eventually get that calcium from somewhere. It'll steal it from the bone. So another reason I don't want you doing that stuff. All right, so let's move on about other things that you may find in your medicine cabinet that can be causing problems. Antihistamines. Got a runny nose, got coughing, got itchiness. Now, if you take them, if you've ever taken them, and I've taken them, can make you drowsy, lightheaded, confused, nervous. They can affect your sleep, your appetite, your sex drive, can cause vomiting, constipation, diarrhea. So antihistamines can be dangerous. So what do we do about it? Now, again, I'm not telling you take or not take drugs. I say that all the time. What can we do instead? So there's something called quercetin. Quercetin is found in things like onions. There's a supplement, quercetin. And quercetin can act as a natural antihistamine. Fixing your stomach can do wonders. Because if your stomach isn't breaking proteins down to amino acids, these big chunks of protein get absorbed into your blood, and the immune system says, I don't know what this big chunk of protein is, I'm going to attack it. And when I attack it, I want to get it out of the system as quickly as possible. What's the quickest way out? The mucous membranes, the sinuses. And so if we have a good digestive system, many times we're able to break the proteins down more efficiently so you don't absorb these big chunks of protein, so you don't have this allergic reaction that you need the antihistamine from. Now, if you have a cold or something like that, that might be a little different. But understand, if you take them, there are going to be consequences for it. And just be careful with that. If you take them, don't think you're going to be able to drive. Don't think you're able to go out dancing. Don't think you're going to operate heavy equipment. Don't think you're probably going to be working in the kitchen with knives, because it can cause some real serious issues. And if you take them on a regular basis, you want to know why you have this constant runny nose. Number one food allergen that causes runny nose, dairy products. Number two food allergen that causes runny nose, wheat. Breads, cookies, cakes, donuts, pastas. And many times it's not just the wheat, it's the fact that we spray glyphosate on a lot of the wheat in the United States too. So people can have reactions not necessarily to the wheat, but to the glyphosate and the wheat. But if you cut out the wheat, cut out the dairy products, let's see if the sinuses get better. If I'm wrong, and you cut out wheat and dairy for a week or two, and you don't see any changes, so what? I'm wrong. I lied. But if I'm right, which I probably am, then you can say, wow, okay, now I understand it. Every time I had a cheese sandwich or a piece of pizza, I had a runny nose. Well, I just don't eat pizza anymore. And if you do eat it, understand you're going to get a runny nose. Now, you shouldn't eat it, but I'm also a realist, and I understand not everybody does what I say. So just be careful with it. So wheat and dairy, cutting out wheat and dairy many times helps the sinuses. Fixing the digestive system can help the sinuses in many cases because of the protein issues. And then making sure you have enough hydration. Make sure you have enough water. Make sure your body has enough nutrients to function normally. Everything we talked about goes back to one thing. Is my body capable of dealing with this issue? And many, many times it's due to nutritional deficiencies. And it's funny, a lot of the deficiencies are caused by excess. I know that sounds counterintuitive, right? We eat a lot of bad stuff, you don't eat a lot of good stuff. And so these diseases of excess that we have, too much alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener, breads, cookies, cakes, donuts, pastas, we have these conditions of excess, and in the process, we're not getting nutrients. So, minimum supplements I think everybody should take, absolute minimum, no matter what, would be Dr. Joe's Super Greens and Dr. Joe's Essential Source. They're two powders. They taste great. I take a scoop of each. I mix them together. I shake it up with I like it with coconut milk, but almond milk, any plant-based milk is fine. Shake it up first thing in the morning. I also add 10 drops of Dr. Joe's vitamin D to that, and that's the first thing I have every morning. One day I ran out of it on the weekend, and I had to wait till Monday to come into the office to get more, and I didn't feel right because every morning I wake up and that's the first thing I do, and I'm like, I just don't feel right. Something's wrong. Went to the office. It was fine. I took it, and I was fine. So those are on the website, drjoe.com. If you're not going to do anything else for your health, you're not willing to do a darn thing, I don't care what Dr. Joe says, at least take Super Green Essential Source, vitamin D, and Dr. Joe's B complex. Minimum supplements. That's all I ask. And then let's get more advanced. If you have high blood pressure, circulatory issues, romantic issues for men and women, nitric oxide. Nitric oxide opens up the blood vessels, increases circulation to every part of the body. We have an ED protocol that we do for men. If you have ED, by the way, men, go to the website, drjoe.com, type in ED, little quiz will pop up, answer the questions, send it back to me. It comes to my inbox directly. And then I'll either send you an email or we'll talk over the phone and we'll discuss some options that are out there. Aside from just treating the ED, I want to talk about what's causing the ED. Is it a pinched nerve? Is it clogged arteries? Is it a lack of nitric oxide in the body? Maybe it's a hormone issue. Let's try to get to the cause. ED is a symptom. It's telling you something's wrong. Don't ignore it. So, anyway, you can do that, but I digress. But nitric oxide, I love it. It's my third favorite supplement. Super Greens and Essential Source are number one, and then, of course, number three, I guess, would be nitric oxide. B complex, absolutely necessary. You pee it out every day. How do you expect to function normally if you're peeing out all the good stuff? You got to replace those supplements. And that's where B complex comes in. Vitamin D, unless you're out working in the yard all day, you're a contractor out in the sun, you're probably going to need a vitamin D supplement. Now, in the winter, I don't care how much sun you get, you're not getting the proper angle of the UVB rays from the sun to create the vitamin D that interacts with cholesterol. That's a problem. If you're on cholesterol medication, could be a problem because you don't have enough cholesterol to create the vitamin D. That's the raw material to create vitamin D. So, Super Green Essential Source, B Complex, vitamin D, nitric oxide, that's kind of like the starter kit. Now, if you have low blood pressure, don't take nitric oxide. But everybody else, I just love it. It's great. It's so much fun. Nitric oxide just makes me feel great. So it's a lot of energy, too. So those are the minimum supplements. They're all on the website, drjoe.com. We ship either the same day or the next business day, or you can come pick them up. In the Atlanta area, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. Come by, pick them up. Save some shipping costs. Love to see you. See your pretty face. And all the hours of our clinics are on the website, drjoe.com. Swing on by. All the clinics carry the supplements. Love to get them to you. So if you're not going to do anything else, at least do some supplementation. Now, I think you should do everything. You should get the nervous system checked, get the digestive system checked, get the diet straightened out, take the supplements. That's my goal. Because as I get older, I'm past my midpoint, I think. In fact, I almost know. I start thinking. You start getting really, introspective. What do I do now? Have I done a good job in life? Do I want to enjoy these final, hopefully many decades? And the only way we're going to get there is to take care of yourself. I don't see any other way to get there. Luck ain't going to get you there. Not in today's society. We didn't have steroids, chemicals, hormones, antibiotics, pesticides, genetically modified food, glyphosate, electromagnetic frequencies. We didn't have all that stuff when your grandmother was alive. And maybe she did have a good life. Maybe she lived to be 90. Maybe she made it to 100. It's a different world now. I don't believe we have the same options. Even though medicine has gone, leaps and bounds, we still don't have a longer life expectancy in general. How have we done with cancer? How's that progress coming along? Not so good, is it? So you got to take responsibility for your own health. And if you don't give the body at least the nutrients that it needs, well, that's your bad. And that comes back on you. You want to make sure you get the nutrients. You want to make sure the nervous system is working. If you have neck pain, back pain, shoulder pain, numbness, tingling, that's a symptom. It's telling you something's wrong. And the number one treatment for back pain is chiropractic care. Most effective, least expensive. For most cases, not all, but most. So if you want us to do an evaluation to determine what's going to be the best course of treatment for your health care, go to drjoe.com, book an appointment right now. Marietta, Duluth, Stockbridge, West Cobb, in the Atlanta area, or online. We can do a remote. And let's try to get to the cause of the problem. And you can do one. It's like a Chinese menu. You can do one from column A, one from column B. We can do it all. We can do some. Let's find out what's going to be the best course of treatment for you specifically. So drjoe.com. In-person visit for a chiropractic evaluation, normally it's $940. I've reduced that for you, my listeners, to $299. That's an exam, x-rays, consultation, first treatment, going over the x-rays, and a complete nutrition evaluation. So go to drjoe.com, book your appointment. We accept insurance, most insurances. Depends what your insurance covers. It's not up to us. It's up to your insurance. And if you're ever in a car accident, if the car is damaged, you're damaged 100% of the time. I've never seen it any other way. Make an appointment. Get checked immediately. Don't fall for these scammers, these ambulance chasers that are going to call you. Hey, I'm from your insurance company. I'm from the hospital. Go see this doctor. It's a scam. No one will ever call you and tell you to go see a doctor or a lawyer. That's a scam. It's illegal, by the way, too. It's a felony. So don't fall for that. You're going to get burned and you're going to be very unhappy. So drjoe.com for all your questions. And send me your questions through the website, too. drjoe.com. So what we're talking about today is dangers in your medicine cabinet. Mouthwash. Did you know mouthwash can be a problem? It has alcohol in it. Children shouldn't drink it. But here's the thing. You have bacteria in your mouth that helps produce nitric oxide. Nitric oxide opens up your blood vessels, increases circulation for brain, for sex, for liver, spleen, kidneys, lower pressure. Very important, nitric oxide. If you're using mouthwash, you're killing off the germs that can cause bad breath, but they also are part of the body producing nitric oxide. So if you're using nitric oxide, if you're using mouthwash, many times you're killing off the virus, the bacteria that help break down and produce nitric oxide. So I'm not a fan of mouthwash. So just be careful with that. If you have bad breath, many times it's due to the stomach pushed up against the diaphragm. There's two types of bad breath. One type is just a rotten tooth, and that has a certain smell to it. But if somebody has bad breath and it smells like a toilet, that's the digestive system. I had a friend of mine the other day, we were talking, and she was saying that she was constipated for 3 days. Her breath stunk. And I've known this woman for like 7 years. She never had bad breath. Her breath stunk. because the food was rotten in her colon. Gases were being absorbed into the blood system. Gases were exchanged from the blood system into the lungs that came out of her mouth. You can't brush that away. And then once she went to the bathroom, everything was fine. But if you have somebody with chronic potty breath, for lack of a better word, you really want to get them to come see us to let's see if it's a digestive issue. Is it a nutrition issue? Are they not getting enough enzymes to break down their food? Is the stomach up against the diaphragm? Are they constipated? And let's see if we can get to the cause of the problem, not just treat the symptoms. So mouthwash is okay, and there's some natural mouthwashes you can get that aren't going to have this effect. You usually got to go to a health food store to get them. And if you have to swish and a rinse, that's fine. Here's a trick for you you're going to love. Every time I teach people this, they go nuts, and I haven't taught this in decades. Get some cloves. I know a place like Sprouts, the grocery store, has them in bulk. Only buy a little bit. I mean, yeah, like if you put them in a plastic bag, maybe an inch high, you don't use them that fast, and they'll dry out after a while. And take a clove, break off the little tips. Sometimes they have little tips on them, little buds, and just suck on it. It'll give you fresh breath. It kills viruses, germs, and bacteria. And as it dissolves, you can chew it and swallow it. It has more nutrients than blueberries, more antioxidants than blueberries. So cloves are one of my secret weapons. I have them in every one of my suit jackets, I have them in my car, and whenever I go to a meeting, I always have cloves. And I put it between my cheek and gum, like tobacco chew, and I'll talk to people. And when I have to freshen my breath, I'll pull it down, I'll suck on it, put it back between my cheek and gum, and continue on. And whenever I'm at a conference or at a meeting or something like that, and somebody sees me pull out this little bag of cloves, and they'll say, "What is that?" And I'll say, "It's cloves." And I teach them about it, and I give them a few. They lose their minds. I was at an event the other day, and a friend of mine is a chiropractor, and I taught him the trick. And about 10 minutes later, he comes up to me and goes, "Give me more cloves." He said, "I'm selling them for you." I said, "I don't sell them." He goes, "I'm selling your cloves for you." I don't sell cloves. And he gave them out, and the next time I saw him, his name is Jay, he says, "Unbelievable, doc. I got in my office now." He says, "I never wanted to talk close to patients because I was afraid my breath stunk." He says, "Now I feel so much more confident and I'm able to communicate with my patients better." I've already given 2, 3, 4-hour classes as a teacher and had a clove in my cheek and gum, forgot it was there. When I'm done, pull it down, suck on it, people come up with questions, my breath smells fresh. Way better than mouthwash. You got to brush your teeth. That's in addition to. Same thing with toothpaste. I am not a fan of fluoride. I recommend fluoride-free toothpaste. You want to make sure they're paraben-free. They should be fluoride-free. You got to go to that health food section of the store you've never been to. And so fluoride-free, paraben-free, those are going to be better choices for toothpaste. Because fluoride can block up your thyroid and prevent you from properly absorbing iodine. So fluoride on your teeth might have some effect on cavities. I'm not arguing that point. I'm not a dentist. I'm not going to argue that point. But when you swallow it, it has zero impact on calories and multiple adverse effects on your immune system and your thyroid. So I'm not a fan of fluoride. Another reason why I like a whole house water filter, or at least a countertop water filter like a Brita or something like that to filter out the fluorine and chlorine. Because fluorine and chlorine can block up your thyroid, prevent you from absorbing iodine because they're what's called haloids, and haloids look like iodine and block up the receptor sites, and your thyroid needs iodine. Another reason to take Dr. Joe's Super Greens and Dr. Joe's Essential Source, because both of them have iodine in them. And most people get zero iodine in their diet. Maybe a little bit from salt, because it's iodized salt. That's what that means. But you don't get enough iodine, and every cell in the body needs iodine specifically to thyroid. So Super Greens and Essential Source, when I created these things, I'm trying to solve as many problems as possible when I created them, and one of them is an iodine issue. So I'm not a fan of fluoride toothpaste, obviously. Please stay away from that. And you can get fine toothpaste that don't have fluoride in it. We're talking today, if you're just tuning in, I'm Dr. Joe Esposito. We're talking today about hidden dangers in your medicine cabinet. Another one is antibacterial soaps. I don't know if you remember, but a couple of years ago, we had this thing called COVID running around. You may not remember that. And the big thing was antibacterial soaps. Antibacterial soaps. Well, it turns out they kill good bacteria as well as bad bacteria. And it weakens your immune system because you need the good bacteria to fight off the bad bacteria. And so antibacterial soaps became all the rage, and it turns out you shouldn't be using them. And in fact, some of them, I don't think they use the ingredient anymore, so I'm not going to push it too hard, is a hormone disruptor. I think they took it out of the soaps, if I remember correctly, because crazy people like me were screaming. This stuff does nothing, and all it does is affect hormones, especially for children. So that's why I'm not a big fan of hand sanitizers and antibacterial soaps. Plain old soap and water works just as well. and you don't kill off the bad stuff. So it actually works better in the long run because you're not killing off the good stuff. You're just killing off the bad stuff with plain old warm water and soap. Wash your hands for 20 minutes. Remember saying happy birthday twice? I think that was the thing that we had to do back then. That's not bad advice, but please don't use antibacterial soaps, and I'm not a fan of hand sanitizers either. Now, if you want to make your own hand sanitizer, you can use alcohol and witch hazel. I think it's on I used to have that recipe on my website. I'm not even sure if it's still there, but it was a hand sanitizer recipe, but alcohol and witch hazel, and you can put some tea tree oil in there if you want to, and that was a natural hand sanitizer. And you don't disrupt the hormones, especially in little ones, because they're getting bombarded with enough hormone stuff. We don't want to keep messing with it. So weight loss supplements. We're talking about some other things too. Yeah, I got time. Okay. Let me talk first about medications for sexual dysfunction. Very popular. If you ever watch any sporting event, you realize that every third commercial is for little blue pills, and all men are impotent apparently, and you got to take these pills. And they work for about 50% of the men. The other 50% it doesn't work for anyway, and one of the reasons is you don't have nitric oxide. You need nitric oxide to open up the blood vessels. So if we give them the little blue pills and we give them nitric oxide, many times great results, but if you give them nitric oxide, they get many times the same results without the little blue pill. 50% of men who it does work for, after about 2 years, it stops working or slows down, and there are adverse side effects to it. So what do we do about that? Well, I'm not a fan of those medications because it doesn't treat the cause, it treats the symptoms. Now, if you have to treat it for the symptoms, I get that. That's your call. But we have a whole ED protocol that we do. It has nothing to do with treating ED. It has to do with treating the cause of ED. Now, it's check the nerve supply, check the diet to see what's clogging up the arteries. We give you home therapies to do, nitric oxide to increase circulation, B-complex. We get you on digestive enzymes in many cases, Supergreen's an essential source. And then we try to get to the cause of the problem. Because again, ED is a symptom. It's not a problem. It's a symptom. The cause of the ED is the problem. So, gentlemen, go to my website, drjoe.com. Just type ED in the search bar, and we can go ahead and send you the protocol and see. We actually want to get together and discuss it. But when you fill out the survey, it comes to me directly. Nobody else sees it but me. So I'm happy to talk to you about that as well, because I know it's a sensitive topic, and I get it. So just be careful with those medications. And like all medications, please lock them up from kids and the elderly. Because if you don't have good cognition and you don't know what you're doing, any medication, including over-the-counter medications, including supplements, can be very dangerous. So please take that caution. And weight loss supplementation, there's a lot of promises out there for supplements. Many of them don't work. We have something called the 21-day detox weight loss program. And what that is you take certain supplements, you follow, there's plenty of foods to eat, but you have to kind of follow this guideline. This is the list of foods to use. And we get you to kind of jumpstart the process because there's a part of your brain called the hypothalamus, and the hypothalamus makes you feel hungry. And a lot of these medications that they give now affect the hypothalamus to make you feel like you're full, so you lose your appetite, so you lose weight. There's a lot of problems I have with that, but one of the problems is you're not eating, so you're not getting nutrients into the body. So if you are taking these medications, please at least take supplements, Supergreen, Essential Source, B-complex, vitamin D, glutathione, clean out the liver, because all medications go to liver eventually. And so please take supplements if you're taking these medications. But many times if you take the supplements and you reset the hypothalamus, I mean, I'm using that as a metaphor, reset the hypothalamus, when you come out of this 21 days, you don't have those cravings anymore. And you're able to eat and make better decisions. And so that's why I like our approach, because it's a natural approach, no side effects. The other thing with these injections is they're forever drugs. When you stop taking them, you start eating, you gain weight again. It doesn't teach you anything. It doesn't train you to start eating nutrients. It just trains you to take the medication so you don't eat. And my concern then is I'm starting to see people get everything from brain fog, heart issues, vision issues. Not everybody, but there are warnings out there that concern me. So drjoe.com, and you just type 21-day in the search bar, and chances are you'll find what we're looking for. And if you do have questions, always send them to me through the website, drjoe.com. I'm happy to answer your questions for you. And I want to say countless questions, but there are days I'll get 10, 15, 20, 30 questions a day on the website. I answer every one of them. And I try to give you advice on things you can do. And again, you don't have to do everything, but do something. Let's try to get to the cause of the problem, not just treat the symptoms. If you have neck pain, back pain, shoulder pain, numbness, tingling, headaches, come see us, folks. Most of you are suffering needlessly. And the biggest complaint I get, I've been in practice 40 years now, the biggest complaint I get is, why didn't I do this sooner? Why did I suffer for so long? And many times it's something as simple as, hey, you know what? You're B vitamin deficient. You know what? You're vitamin D deficient. You know what? Let's get some digestive enzymes in your body so you can break the proteins down more efficient. Let's adjust the stomach. Let's fix the nerve supply to the spine. Many times the answers are easy. So if you want to make an appointment, drjoe.com. I'd love to be your doctor. Bring your friends, bring your family, bring your kids. Let's get the kids checked too. Because they're healthy, they start out life, they usually stay healthy. Follow me on social media. It's just look up Dr. Joe Esposito. Facebook is the Dr. Joe Esposito. And we post every single day. If you don't like it, unfollow me. Sign up for my newsletter. It's on the website, drjoe.com. And sign up for it. We send out little posts, little pop-up lectures, little tidbits. Sometimes we give away presents, supplements. I give away concert tickets. Absolutely free. If you don't like it, unsubscribe. I'll never give your email address out. You don't like me on social media, unfollow me. Let's give it a shot. Let's see what happens. I always say, let's see if I'm right. And if I'm not, so what? I'm wrong. But I'm not wrong. drjoe.com. I don't think supplements are a luxury. I think they're a necessity. So all the supplements are on our website, drjoe.com as well. And if you're a podcast junkie, just go to your podcast service, Dr. Joe for the health of it. Dr. Joe for the health of it. I'm Dr. Joe Esposito. Thanks for tuning in, folks. I'll catch you next time. You approve? All right. Thumbs up on everybody. You have questions for me, John?
Why do dentists recommend mouthwash?
I don't know. They didn't take my class.
What is the best oil to cook with?
Coconut. Extra virgin organic coconut is going to be your best choice. It has a high smoke point, it's called. Olive oil is not as high, so if you're going to cook at a lower temperature, maybe olive oil, but cooking is going to be coconut oil. What else?
What is the healthiest type of bread?
Sprouted bread. I used to say no bread, and then people yelled at me. Sprouted bread is going to be your best bet. It's called Ezekiel, is a brand name, but sprouted bread. Kroger has sprouted bread organic. It's a lot cheaper than Ezekiel brand name. But sprouted bread, they sprout the grains, and it breaks down the enzymes. The enzymes break down some of the protein issues and the phytic acid and some of the anti-nutrients in it. So sprouted bread is going to be your best choice.
I work out and I don't want my muscles to plateau. Can you talk a little bit about muscle confusion?
Sure. Yeah, you don't want to do the same thing over and over again because the muscles get used to it and they say, okay, this is all I'm going to do. So muscle confusion, you want to shake it up a little bit. And so you can do something called high-intensity interval training where you go as hard as you can, no matter what exercise you like, as hard as you can for eight minutes, and then you rest, and then you do 8 minutes again, and then you give it a break, and then you give it 8 minutes again, and then you're done with your training. So that's 8 to 24, so about a half-hour program. There's a group out there. I have no affiliation with them except I go there and work out. It's called Body 20. And it puts you in a full body suit, and it causes muscles to contract. So it's kind of cool. And then you try to work out with the muscles using electrical muscle stimulation, so that's kind of cool. Yeah, but shaking it up is the best thing. And just my grandfather, he's a big mountain of a man, big German man. And I remember when I was in high school, I played football. And so I lifted weights with my uncle. We all lived very close to each other. And my big German grandfather looked at me one day. He says, ugh, you want muscles? Here's a shovel. Go dig a hole. And I'll never forget that advice because here I was working out, building up biceps and triceps. I was a 210-pound football player. I had a 28-inch thighs, 44-inch chest. But they weren't practical muscles. Here's a man who was very large, big muscular guy, but he had practical muscles. He worked his muscles. And so don't always think gym to work out. Think gardening to work out. Think mowing the lawn to work out. Think cleaning the house to work out. That's muscle confusion where you get practical muscles. So shake that up and add that into your protocol. I think you'll like it. So.
Healthiest type of milk?
Coconut, not cows. Not a fan of dairy products at all. Coconut milk is probably going to be your best bet if I had to pick one. Organic soy milk is okay too. I'm fine with those. If you have to do almond milk, I do sometimes because it's on sale. But if I had to put them in order, I'd probably say coconut and soy are probably tie, and then almond milk. And then there's hemp milk, there's chia seed milk, there's cashew milk. A little less practical, but those are all fine. Yeah. What else?
Are the acids in pineapple okay?
They can actually digest your mouth. There's bromelain in there, which is a digestive enzyme, and when you eat it, sometimes it tears up the inside of your mouth. That's actually digesting the protein in your mouth. So don't eat too much if it irritates you. If it doesn't irritate, it's fine. Yeah, but bromelain is great. It's an anti-inflammatory, but you are digesting yourself when you eat pineapple. So makes my mouth tingle.
That is all.
All right, thanks, guys. I appreciate it. Please follow me on all social media, Dr. Joe Esposito. I do appreciate that. Any questions, just send them to the website, drjoe.com.